Kenya marked World AIDS Day with vibrant celebrations across the country, emphasizing awareness, prevention and community mobilization to combat HIV in line with the nation's goal to end the epidemic by 2030. The events were led by the Ministry of Health and the National Endemic Diseases Control Council (NSDCC), showcasing efforts to engage men and boys as pivotal agents of change in this year's theme. At the Nyayo National Stadium, Health Cabinet Secretary Dr. Deborah Mlongo Barasa flagged off the half marathon organized by the National Endemic Diseases Control Council (NSDCC). This initiative traversed counties with activities aimed at rallying communities to champion HIV prevention and support for those living with the virus. Dr. Barasa reiterated the government's commitment to health reforms under Universal Health Coverage (UHC) to integrate HIV care prevention and treatment into primary healthcare services.
So there is need for interventions, to show that we have friendly clinics that are addressing the men and also friendly ones for the young people and the adolescents as well as for the children. And so those are the interventions we look into so that we have improved coverage and so that we are leaving no one behind.
We are struggling with sexual and gender-based violence cases, and we are also struggling with new HIV infections among the younger people. And we want both boys and girls and men and women to come together because, as you know, that most of our infections are through sexual transmission.
In Turkana County, marathon winners were appointed as community ambassadors to spearhead HIV awareness campaigns. Joseph Simiyu, the county's HIV coordinator, highlighted the strategic importance of this approach in mobilizing communities.
Hawa tungependa tuwachukue wakuwe kama ambassadors wetu, hata wakiendelea na hiyo mchezo yao waweze kutupitishia messages kwa watu wengine.
Religious leaders in Rift Valley and Western Kenya called for a government ban on miraa and mogoka stimulants, linking them to risky behaviors that exacerbate HIV transmission. Abubakar Bin, the Rift Valley's Imam chairman, advocated for greater responsibility in curbing practices that contribute to the epidemic.
Kutaka kupigana na janga hili la ukimwi ni kuangalia namna gani tutakabiliana na madawa ya kulevya.
And in Narok County, officials highlighted that Transmara West has the highest infection rates at 4.8%. Further, the region has set a target to significantly reduce infections by 2027 through community-centered strategies and robust health interventions, as outlined by the area's HIV/AIDS officer.
So unaona kwamba watu 5 kati ya 100 hapa Transmara wako na virusi. So tunaboda pia one of the 10 highest burden counties of HIV in the country, which is Migori County and Kisii County.
While Kenya has made significant strides in reducing new infections and expanding treatment access, the Ministry of Health emphasized addressing gaps in children's care, geographical disparities and stigma to sustain progress. Now, despite